will detail the findings of a phase 3 prospective trial comparing panitumumab and bevacizumab in combination with standard doublet first-line chemotherapy for patients with RAS wild-type metastatic colorectal cancer. The lead study author, Dr. Kakeyuki Yoshino, is the chief of the Department of Gastrointestinal Oncology and deputy director of the National Cancer Center Hospital East in Kashiwa, Japan, and he will present the findings. Dr. Yoshino? You can move it forward.
Okay, thank you. Okay, thank you very much. First of all, I want to say it's a great honor and a privilege for me to be given the chance to this the ASCO honorable plenary session. My name is Takayuki Yoshino, a medical oncologist basis, National Cancer Center Hospital East in Japan. I already introduced my presentation talking about the panitumumab versus bev in combination with the standard chemo modified mFOLFOX6 patient in the first-line setting and patient with RAS wild-type metastatic colorectal cancer. So, background information that the colorectal cancer is the third common diagnosed cancer worldwide, and estimate 2 million new case diagnosis 2020. So, about the 36% of the colorectal cancer patient had metastatic disease at diagnosis. So, addition of the anti-EGFR or the anti-VEGFR monoclonal antibody to standard chemotherapy improve overall survival of patients with metastatic colorectal cancer up to median overall survival of the 30 months. So cumulative retrospective evidence suggests that longer overall survival with the anti-EGFR antibody over anti-VEGF antibody, bevacizumab, in patients with RAS wild type and the primary tumor, left-sided tumor, defined as a descending colon, sigmoid colon, rectosigmoid, and the rectum. So approximately 35% of the metastatic colorectal cancer. Nevertheless, both anti-EGFR, VEGFR antibody are used in patients with RAS wild type, left-sided tumor, which warrants prospective comparison in this refined population. Now, please keep in mind, US in the United States, both anti-EGFR, VEGFR was used. So Paradigm is the first prospective study to test the superiority of panitumumab versus over bevacizumab plus standard chemo for patients with RAS wild-type patient. So this is the trial scheme. You can see patients with RAS wild-type patient, RAS wild-type metastatic colorectal cancer were randomized in a 1-to-1 ratio comparing panitumumab versus bev in combination with the same modified mFOLFOX6 until disease progression, patient withdrawal, intolerant, toxicity, and curative resection. The primary endpoint is that left-sided population OS. If the significant hierarchical way, we analyze, moving forward to analyze OS in the overall population defined as both left-sided and right-sided population. So here is the most important slide in my presentation, left-sided particularly. You can see OS in the left-sided population, you can see with a hazard ratio 0.82, p-value 0.031. If the p-value 0.04202 less than, so we will consider as significant. So we move forward to the second primary endpoint analysis, OS, in the overall population. You can see similar message brought forward in this patient population. Looking at the median left-sided once again, you can see more than 3 years overall survival in panitumumab plus modified mFOLFOX6, 37.9 months. It's never reported previously. So in conclusion in this presentation that phase 3 paradigm study met primary endpoint 1 and 2 both. They demonstrated the superiority of the panitumumab over bevacizumab in combination with the modified mFOLFOX6 in both left-sided overall population both. You can see here the median value overall survival, the 37.2 months favoring panitumumab in left-sided population, 36.2 months in overall population, so proceeded more than 3 years in both populations. So panitumumab and the modified FOLFOX6 demonstrated longer survival ever reported in the first-line metastatic colorectal cancer phase 3 setting. So in conclusion, in this presentation, these results established standard first-line combination regimen for patients with RAS WT type left-sided metastatic colorectal cancer. So currently, the multi-omics analysis are ongoing. Some data already finished. You can see here note, 92% of the plasma tissue pre-treatment already collected and analyzed. Now you can see here right at the bottom, as post-treatment, you can see here 76% of the plasma also be collected, and also 161, which is a number, old number, who conducted a conversion surgery at the curative intent already collected. These are analysis shown here, middle, white box. You can see tissue plasma DNA sequencing, of course, the RNA sequencing, signature analysis, multiple immunofluorescence analysis with artificial intelligence. These results also be available in the future upcoming international meeting. So thank you very much for kind attention.
Thank you very much. Now we are going to have just a little expert comment on that before. So if you can have a seat and be comfortable. So now Dr. Kathy Eng will make a few additional comments about the significance of this research.
So I think it's really important to keep in mind for our patients with surgically unresectable disease, the expected 5-year survival is still only at 15%, and it's only changed about 6% over the past 20 years. We are constantly looking for new breakthroughs, and this is one of the longest overall survivals that have been reported. The median follow-up is extremely long. It's 61 months, if I'm correct. Granted, this is specifically for the left side, but also it's been an area of controversy, especially here in the United States, because we have not necessarily had a prospective trial. We have looked at several of our other trials that were not specifically powered for the left-sided tumors. So this adds quite a bit to the literature, and I think we're quite excited about the possibilities of increasing the survival of our stage 4 patients.
Thank you very much, Dr. Eng. Next.